Welcome to the Local Spotlight Show here at WJBM Studios in Jerseyville, Illinois, the voice of the Tri-Counties. I'm Chris Lorton. I am your host today, and my guest, which I'm happy to have here in the studio, Stace Holland, CEO of Boyd Healthcare Services of Carrollton, our neighbor, our Greene County neighbor. So.
Good to have me back. I'm glad. It's good to be here. It's been about a year since we talked.
I know. It has been a year. We talked about where you came from. We'll just remind people history. Right? You've been here at Carrollton as a CEO for how long now?
Year and a half. I started in April of 24.
Yes. And before we get into the changes and what's happened as CEO. First, share with the listeners where you come from.
Well,
because you're not from around here.
Right. Does the accent give me away?
A little bit.
Yeah.
A little bit.
Well, I from Texas. Grew up in Oklahoma. Most of my career was in Texas. And a couple of years ago, we decided that we were going to retire and we were going to get out of the dry climate of West Texas. And we found a little ranch in southern Missouri, and we bought that.
Yeah.
And that's what I was going to retire to.
Yeah.
When this Boyd opportunity came up, and I was so energized about the opportunities here in Carrollton and Greene County that I couldn't say no. And so I am.
So they got you in, interviewed you, and you kind of fell in love with the town. You liked the atmosphere. You thought you could help them out.
I did. I really fell in love with the opportunity and the board members that were looking for ideas in strengthening the hospital and ensuring that healthcare continued in Greene County for another 80 years.
Yes, because the situation with rural hospitals across the nation, it's a little tough, right?
It is tough. Payers are always trying to figure out how not to pay the bill. And we're trying to figure out how to continue to improve the services provided, how to keep electronic medical records secure, and all the new modernization with AI, and how does a rural hospital stay competitive? And we felt like the only way you can do that is you got to strengthen your financial position.
Strengthen your financial position, but the nice thing is that you're local. You know, it's nice having, if you're sick or if you have an injury or whatever, it's nice to have something right at home,
Absolutely.
Where you can get to quickly and people and can take care of you.
Yes.
So, that's the win-win right there.
It is, and I think the uniqueness of Boyd Healthcare Services is the ambulance is part of our hospital and part of our operation. So it's seamless. We're going to transition, instead of having an ambulance service and an ER service, we're going to call that emergency services, where these two programs will work hand in hand with each other. So, the ambulance is an extension of the ER. It's just done outside the walls of a hospital. So better communication, getting these teams to work better should increase the response and the seamless care that starts in the ambulance and then finishes in the emergency room.
So the board at Boyd, they brought you in, they interviewed you. What was your plan as far as, now you've been there like a year and a half, right? So in a year and a half, what was the idea? What was the board wanting you to do, and what's happened?
I don't know if the board actually had a vision. I think what made them attractive to me, or
that's what I'm asking.
For me,
why were they attracted to you?
Is I had worked with a couple of hospitals just previously that were failing financially, and the team came together and wrote a plan. And everybody bought in on the plan, and then it was implemented. And both of those hospitals transitioned. One of them has transitioned incredibly well, that it really had actually filed bankruptcy, and it was trying to still survive under some of that bankruptcy. And now it's become the regional medical center.
Wow. Now, was this in Texas?
This was in Oklahoma.
Oklahoma.
Yeah.
Okay. So you got a plan together, and basically to make money, right?
Absolutely.
Yeah,
guys.
I mean that's the bottom line.
That's right.
I mean, actually, that's what I've tried to do here at WJBM. I mean, it was down and out in Beverly Hills, and it's just like, well, we got to figure out what makes money, if we're going to keep operating. Same with you guys.
Exactly. Some people will say, oh, you can't make a lot of money because you're a nonprofit. But we have to understand that a new CT scanner is $500,000. So if you're not making enough money to replace your equipment, eventually you won't be in business.
That's right. Now, before we start this interview, you had some numbers, okay?
Yeah.
And kind of going over them. I mean, so inpatient. Explain what inpatient is.
Those are the patients that are admitted to the hospital because they really can't go home and continue their healing process. So they'll stay at the hospital 1 day to 3 days. Every now and then we'll get a patient that stays past 3 days, but not very often.
And that's went up. You've increased that in the last year.
We have.
And the number is like 52%.
We have a 52% increase in our hospital admissions
in just 1 year
from 2024.
Man.
Yes.
Would you be interested in helping me here at the radio station?
Well, I would love to, but man, this is I do not understand airwaves.
And then another item, skilled. What is skilled? That's up 17%.
Yes. The skilled, and you may hear it called skilled nursing units or facilities. In critical access hospitals, we'll use the term called swing bed. Now, these will be for, and really it's a in-hospital rehab. So these are for patients that will go to a larger facility and have surgery. And they can't stay at that facility because they no longer have an acute illness.
Okay.
But they need a rehab program. And so under the critical access hospital designation, we can provide that care for many, many days. And this is really just a transition from your surgery to help you get strengthened, work with nursing, physicians, physical therapy, occupational therapy, and then transition you to home.
It's, I've had my experience in the years of having family members injured or sick and having to travel back and forth to St. Louis to see him. Boy, I mean, it's so time consuming.
It is.
And having somebody recoup, in your own town it's just.
Well, we've learned along the way that the healing process is greatly improved when you're around your family members. So getting patients back home around their neighbors and their friends and their family really helps increase that healing.
Do you see that even increasing more? You got 17%. I kind of see that could go up even more as the year goes on.
It's hard because a lot of the Advantage plans won't approve these swing bed admissions.
Oh.
And some of the Advantage plans won't approve a hospital admission. And one of the rules is you have to be in a hospital under acute admission for 3 midnights before you qualify for the skilled rehab swing bed program. Now, Congress is talking about that, and they're talking about removing that criteria, which I hope they do. That would greatly enhance the rehab opportunities that can happen in rural towns and small towns, rural hospitals. So I keep a close watch on that, and I'm pushing our representatives and senators to, yes, let's remove that barrier.
Yeah. How about ER? Tell us about ER.
Well, that was
the emergency room.
Absolutely. And that was the plan. That's what kickstarted the transition for Boyd, is finding physicians that could cover the ER that our community believed in, trusted in, and those physicians supported the initiatives of the hospital. So, I think what we ran into, and not just Boyd, other places, is it's easier to transfer a patient than it is to admit one. And sometimes you can find ER physicians that see a patient that needs to be treated, but they'll just transfer them to another hospital. And our transfer rate has gone down by 50%. So thus, that's where some of those admissions have come from.
Yeah,
is keeping them local, treating them. We've got a great staff.
Great.
So it's good to put their skills to use.
How about you got radiology? That's up as well. 11%.
Yes. Well, with the increase ER visits, there'll be more X-ray exams, but we're also seeing our outpatients as a whole grow. Our clinics have done. We've seen growth in our clinics, which many times when you go to the doctor, he's going to order some lab work or some X-rays, and so that's where that growth in radiology has come.
And then therapy. So you had therapy was up 6%.
Yes.
So that's great. Now, does the wellness center play a part in that? That new wellness center where it used to be the grocery store,
Right.
is that part of the therapy or not?
No, that's really part. It's we hope that the community will use it as a continuation of that therapy. So physical therapy can strengthen your injury or strengthen your surgery, but we hope that you will continue that exercise program at the wellness center. What happens is when patients come from other hospitals after surgery or after an injury, and those discharge planners or maybe even those physicians get familiar with the therapy that we're providing, and they believe in it and they trust in it. And so as we do more, we're finding more physicians believe in our therapist and are referring and giving orders to outpatient physical therapy and occupational therapy.
Great. Hey, if you're just joining us, I have Stace Holland with me, the CEO at Boyd Healthcare Services in Carrollton, Illinois. He hadn't been in here for a year, and we're back, and we're just kind of rehashing what's going on in the last year and a half. Now, the one thing that was down on your numbers was lab.
Yes.
Lab's the only thing.
Lab's the only thing. I think if that number's right, we were down about 14% in our lab procedures. Well, we lost a contract with the nursing home in Whitehall.
Oh.
And that represents that decline in labs. And it was something we just weren't able to address quick enough.
Mm-hmm.
I believe we're going to get that business back.
Yeah.
But we also needed to understand how the nursing home got paid. And there is when the nursing homes can do skilled patients also. But the nursing home has to pay the labs that those patients need. It's not reimbursed through any payer, Medicare, Medicaid. The nursing home has to pay it. And we failed to recognize this because the opportunity we have with them that somebody else ended up doing is they did a direct contract and they gave them some reduced rates. And so now we're coming back behind saying, hey, we're both trying to make healthcare go in Greene County and strengthen it in Greene County. Let's work together. What kind of reduced rates can we provide the home for those skilled patients?
And so kind of breaks down to, you said expenses were up 10%, but revenue was up 25%.
Yes.
So that's good. That's a great number.
And I use that percentage because, percentages can sound really good. If you made $1 and then next year you made $2, you're up 100%. But to put it in realistic terms, our charges this last year, based on that volume that we just went over with those increases, our charges went up $5 million.
Ooh.
Okay. And so along with that growth, we did have expenses. Supplies have gone up. We have added staff.
Everything's up.
Everything's
Yes.
up. Grocery bills up. And so I think that was a good trade-off of seeing now 10% represents about a $1.5 million increase in expenses, but the $5 million increase in revenue has really, really enhanced the hospital and put it in a better financial position where we can start looking at maybe some more services, maybe some brick and mortar or construction, and adding on to the services that we already provide.
Is there any plans to maybe rebuild one day in a different spot, a newer hospital?
Yes. And I think that we really, really need to, for the sake of all the residents that live in Greene County and maybe even the surrounding counties. Now, the hospital building that we're in now is 83 years old, and it has served us well for 83 years. But when we start to look at it and ask the question, will it serve us for another 83 years? I think the tough answer is no.
Yeah.
And we're going to have to either and if you've ever done any home remodeling, sometimes the cost of demolition and reconstruction is more than just reconstruction. So I think that's kind of where we're at. We own property there close to the hospital. And I think that the plan is to get ourselves in a position to build a replacement facility in the next 4 to 5 years.
Yeah, get it up to speed.
Yes.
Get up to 2025.
Yes, yes.
Right. But you had a nice, of course, COVID was bad, but there was a nice surprise for you with COVID money. Tell us about that.
Well, shortly after I started, by the way, I'd like to give a pat on the back to our Chief Financial Officer. She's fantastic. But I was sitting in her office, and
what's her name?
Kate Garner.
Kate Garner.
Yes, and
shout out to Kate Garner.
Oh,
all right.
She does a great job, and so do others. I hate just singling one out, but in this case, it was Kate. I happened to be in Kate's office, and I just read something on a hospital periodical magazine about the now I've gone blank, some COVID funds.
Yeah.
And some ERC, employee retention credits. Now, this is when the government wanted us to keep paying our employees, but they restricted some of the access that patients could have to hospitals. So our revenues were going to go down, but we were still going to have to pay the employees. And so the government said, hey, we will refund you what you had to pay those employees.
This timeline.
Well, I don't know whatever reason Kate didn't apply for that. Maybe it was she didn't read the same article I did or what. But we applied for that, and we were approved, and we just got notification this week that within the next 30 days they're going to fund that. And with the expenses, we had to hire a firm to help us do the application. And so I think the net we're going to receive is about $1.3 million.
Nice.
But
that's a nice Christmas present.
Absolutely.
Yeah.
I thought
when it comes out of nowhere.
Yes.
Yeah, just like, oh, here you go. Here's $1.3 million.
Yeah. Now that $5 million didn't include that, so now we're going to be up to like $6 million. I expect a plaque on the wall.
Well, that's great. That's great.
But, that project just keeps on giving because this is money that was owed us a couple years ago.
Yeah.
The government pays interest, and we're actually looking at $400,000 in interest on top of that $1.2 million.
Wow!
So
great.
It's going to be great.
It's going to be great. I'm sure I think you surely have a purpose for all that, won't you?
We hope that we can give some of that money to our foundation, maybe as a jump start for that new hospital, and maybe it's the foundation for a capital campaign. We'll use some money for remodel and some construction. Yeah. So,
how about Whitehall? Been a little talk about Whitehall. What's going on there?
It has, yes, Whitehall's been on the drawing board, I guess, for over a year. And before I came, they bought the property and leveled the property so we could construct a new clinic there. Currently, the clinic's in root house, and it is in need of repair. So my job, I guess the dilemma we had is where do we find the funds to build that? Now, the bid from the architect told us that a 4,000 square foot building is going to be $2.3 million. Well, we didn't agree with that, so we're using some local contractors from Greene County, and the bid's going to come in about half, about 50%.
I like that, man. For sure. Local.
Yes, and so how are we going to get it? Now, we applied for a grant through Senator Durbin's office. That still looks really positive.
Good.
There's been some back and forth. Is the Trump administration going to fund these grants or not?
Right.
But we're staying positive. Senator Durbin's staying positive. I don't think we're really going to know till the start of the new fiscal year for the government, which is October.
Okay.
We're keeping that out there. But if it doesn't come through, we just got this COVID money. So I think the construction of the Whitehall Clinic is going to be real.
Great.
Now, the dilemma with the grant is it won't refund anything that we've already spent. So I don't want to use that COVID money to start construction on the building and then get the grant, because the grant won't refund it. We'll sit and wait for a few more months, and then some decisions will be made on when to get started and how to fund that building project.
So in the last year and a half, we've definitely improved. And what's the long range look? What do you want to be? Where do you want to go? Like, I mean, what is long range? Is it 10 years ahead, or what are you thinking?
I'm thinking 5.
5?
Yes.
Where do you want to be in 5 years?
I think it's that replacement facility.
Yeah.
Now, where do I personally want to be? I want to be riding horses and not thinking about how to pay the bills and payroll. But between now and then, we're going to continue to strengthen the financial bottom line of the hospital, so it puts us in a good position for those transitions. When you think about a year ago, we came through the year at a loss of over $1 million. And then we look at 25, we're going to have a profit greater than $100,000. So $1 million turnaround, $1.5 million turnaround in 1 year is what the hospital needed.
Yes.
So there was a list put out not too long ago of 9 hospitals in Illinois that are on the endangered list, and Boyd is not one of them.
Hey, that's what you got to like.
I am happy for that, and I hope all the residents. And our success comes from our community.
Yeah.
Our community found value. They found trust in the care that we provide, and they started using it. And as you see by the volume growth, they're using it a little bit more than they were.
Yes. Well, any last words you'd like to say to the listeners before we wrap this interview up?
I happen to be in a community, I won't name the name, that has it's a little bit bigger than Carrollton. The county may not be any bigger as far as residents, but they have a replacement hospital. And I was asking the person, now this was several months ago, I was asking the CEO there, how did you get to this place where you have this beautiful building and all these services? And he pointed out front and he said, see that building out there? That's a specialty clinic. I said, where do you get your specialists from? And he said, Springfield Clinic. And so I made it my mission to create a relationship with Springfield Clinic. And today we have 2 cardiologists coming to Carrollton from Springfield Clinic.
Oh, man.
And so some of that radiology growth has come from the cardiologists there doing more ultrasounds, more echoes, EKGs. And so, I always come from the revenue side, but let's don't forget that this is care that's being provided to our community, and they're not having to drive to get it, which is a cost savings, and it increases the care that we're able to provide there locally. I hope that you ask about that vision. Mm-hmm. I hope someday I look out my window and there's a clinic there, and it's full of Springfield Clinic specialists.
Yes.
Gastroenterology, orthopedics, many of those things that would just keep our residents from having to travel out of town.
Yes, that's big. Well, Stace, thanks so much for coming in.
I appreciate it.
Keep up the good work.
Thank you.
And I'll see you in another year. We'll see where you're at.
Yeah. Okay. All right. Thanks so much.
Maybe sooner. I don't know. Take care.